good morning doctors. So we'll start with something very important thing. So some of the doctors are asking, sir, it's very difficult to revise the medicine. It is very difficult to revise the medicine. We were just revising for once, twice, thrice, but still we are forgetting so many important topics, very pinpoint, precise topics. So can you give us some good strategy in order to just overcome this problem where most of the doctors are facing? So please give us some good strategy so that we can finish medicine revision as perfect as we can be, so that we can finish it and save some time for the rest of the subjects. See doctors, I just want to make one thing clear: no one can revise medicine 100%. No one can revise. No one. The mags of mags, a topper. See, as a topper, I can see, I'm not boasting myself that I'm a big topper, but I can say one fact that no topper can revise. The maximum a topper can revise is 94%. That's it. That is the maximum percentage a topper can revise the medicine subject. But that 94% also, it is from the notes only. Don't think like this 94% will be from Harrison. No. This 94% is only from the notes. That's it. And the Harrisons, if you ask me, what most of the toppers go for the Harrison is the flow charts. But even this one also, most of your mentors, professors don't say this. Sir, which flow charts that we should say? See, there are so many algorithms, right? Algorithms in Harrison. Algorithms which are related to neurology, nephrology, CVS and emergency medicine. These 4 subjects algorithms you just prepare from Harrison. You just give it a look. Don't prepare, don't revise. Just give it a look. Now coming to the flowcharts and tables. Very important, flowcharts and tables from each and every systemic chapter from Harrison. You just give it a look. Don't leave any table from the systemic component. If you ask me, sir, even in particular which chapters that we should go, I will give you 4 chapters. These 4 chapters should not be missed. First one is CVS, second one is CNS or neural system, and third one is infections. Very important, infections you will get. And fourth one is rheumat. These 4 criteria tables from Harrison's, these 4 chapters should be on your fingertips. No need to go for depths, no need to go for in-depth knowledge. No one want that bullshit. Only superficial, only just superficial reading. That is, what are the things that you should go from Harrison? That is tables from the 4 chapters which I said. Which are those? CVS, CNS, infections and rheumat. Tables and criteria. Now if you come to the next one, that is algorithms from which chapters? That is very important: emergency medicine, CVS and nervous system. These 3 things regarding algorithms you should be reading from Harrison. Now coming to the strategy, sir, how to finish the revision, sir? So we want to know about the strategy. If you ask me the strategy, first what you should do is be thorough with the basics of the condition. What is meant by the basics of condition? That means, for example, if you have a case, if you get a case of cardiomyopathy, what are the pathological features? That is the first one that you should be thorough with. Second one is, what are the clinical features that you see in cardiomyopathy? The third one is very important. What are the specialized features? For example, if you say like swan neck deformity is seen in some sort of rheumatological conditions, right? Swan neck deformity. And gunstock deformity, yes, you see in orthopedic fractures, but gunstock deformity is also seen in some neurological conditions. Don't forget this one, very 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 important. Okay, so like that you will have some specialized feature, either it's one or two from the cardiomyopathy. Those specialized features you should not miss. For example, cobblestone appearance of nuclei on the pathological investigation is seen in which condition? Or you might get an image showing what is something called bilateral pathway or bilateral road or tram track appearance is seen in which condition. So like that you have some specialized features for every condition, most of the conditions. That one you should remember for sure. For example, you have double barrel, you have Mickey Mouse, you have something called banana sign, you have lemon sign. So all these signs, these pictures, everything specialized features that you should remember with that condition. So what is the thing that you should remember? The main important thing is be thorough with the basic. No need of very something like, I call it explicit content but not explicit. No need to go on with very in-depth analysis. See, no doctor will ask you those things, trust me. Even Inicet will not be asked from depths of knowledge. No, they will ask you only superficial, but that too very clinical oriented. So what I am telling is, you just take a chapter, something like CVS, cardiovascular system. You just take a note of all the conditions in the CVS that you have written in the medicine notes. For example, you take cardiomyopathy, then infective endocarditis, then rheumatic heart disease, then congenital anomalies of heart, then hypertrophy, cardiac hypertrophy, then you have something called the oncological conditions of cardiac conditions. So you just take a note. So you just go on reading each one of it. Just don't read it, you just look through it. You just give a basic superficial, like, okay, cardiomyopathies, so and so, so and so, so and so, we see so and so features, so and so clinical features are observed in the patient. Treatment is this one, gunshot, finish. That's it. You just end the topic there. Then you go for another one, infective endocarditis. What are the causative organisms? What are the clinical features that we see? What is the peculiar feature that we see? And what is the treatment of choice in case of medicine? You just finish it up. That's it. That's it. Close the topic there itself. Then you take rheumatic heart disease. What are the clinical features? What are the peculiar features? What are the signs and symptoms? And what is the treatment of choice? That's it. Finish. See, whatever you read or not, but clinical features and specialized features of all the, or at least most of the conditions, should be on your fingertips. That's the most important thing that the examiner will expect from you, not any other thing, right? So first you should go on with the basics. Then what you will do, then after noting all these things, then you just go on with the treatments, roughly go on with the treatments. And after completion of all the topics in a basic manner, you just make a long plot, you just make a gist of those conditions. Cardiomyopathy, yeah, I finished it. Then see, infective endocarditis, yes, I have studied this one. Then for example, yes, you have some syndromes, very important syndromes. Have I read or not? Down syndrome, Patau syndrome, Edwards syndrome, then Prader-Willi syndrome. Then you have one more thing, that is Klinefelter syndrome, Turner syndrome. These are all main basic syndromes. Have I finished it or not? Yes, I finished it. See, don't think like this is wasting your time. No, this is not at all wasting your time. Actually, by doing this strategy, what happens is, you can cover pharma, you can cover patho, you can cover pediatrics, you can cover genetics, all in one shot. You will cover all those things, one shot, finish. So make a gist of all the conditions, and from the notes itself, from your notes only, you just take the list of all the conditions. You just read each one by one topics, and or else, for example, you have, see, you got a total list of say something like 8 topics. I'm saying example, right? What you do is you just make them into categories, 3 topics. So this is category 1. So you take a time of something like, okay, I will take 30 minutes, I will finish this category 1, very important 3 topics. Then category 2, very important 3 topics. So like that you slowly finish all the components. See, even if you take 15 minutes per category, if you take like 10 categories, 30 topics will be revised. From the 30 topics you will get at least 5 to 6 MCQs. That means, for example, if you say like in 6 to 7 hours you can gather these all marks. See, it's very simple strategy. These are the simple ETBT strategies most of the toppers use. They actually, they look very simple, but yet they are very much extremely powerful. You can't even imagine what sort of wonders will do. What most of you will do, what most of the normal aspirants will do, they simply start from A in the notebook and they go all over in the to the point Z, to the last page of note. You maybe you remember a 40 to 50%, but you can't remember at least 90%. You can't do well in the examination. This won't work, man. This won't work. What you have to do is you just make one strategy. One strategy is always needed. You are going to a war. You just don't go blindly with a sword in your hand and just don't go and fight. You have something called vyuha. Either you have Padma vyuha, some vyuhas you will write, and according to that you will go and fight the war. So even exam also is like a war. You make a strategy like, this is what I am saying. You just take a list of all the components. Next, coming to the images, what happens is, while you are going through all these conditions, what you do is just listen. After completion of all these conditions, then you go for the images. Just you collect all, you take 15 to 20 minutes of your time and you just assemble all the medical images you have in one folder of your mobile phone. Just name it as images medicine. You take one by one image and you just read it. You just recognize the image and you just get the details of it. Just you memorize the details. Guys, this will do wonders for you. Trust me. This is the only strategy by which you can revise the medicine as fast as you can. If you simply take from point A all the way to point Z, you won't remember most of the subject. What you should do is you make a list of all the topics you have in the medicine in your notes only. Don't need to go for textbook, write all the topics. No need to do that. You just make a list of it and you just categorize the topics, 10 topics in one category or 10 topics in one family, and for every 20 to 25 minutes you finish one family. Finish means don't kill the family. I am asking you, finish the family means you finish the topics, right? And after completion of all the topics, what you do is you just make a list of all the images, just keep it in one folder and just try to open from the first image itself. You just look the image, try to recognize it, get the details inside your mind. You try to remember all the details you can remember from that image. You just try to recognize the treatment, everything. You will remember not less than 80% of the subject. 80% of the subject is enough to solve 22 MCQs in the examination. That is my guarantee. That is my guarantee. Okay, so this is one good strategy. Tomorrow I will just make one more important strategy regarding SPM. So we'll discuss about that. Till then, take care, revise good, revise nicely, prepare the notes. Thank you. Signing off, your wise dog.